Hey everybody, I wanted to pass on a tip. If you treat pediatric patients or you have a young child that is timid, scared, they don't want to open their mouth, they're cowering or hiding behind their parents, this is the way you do it. And here's the trick. When they walk in, they could be 3, 4, 5 years old or even older. I would have one parent sit in the dental chair and say, okay, you're going to sit with mom on our lap. And I would tell the parent, let's put your child on your lap or in between your legs so that they are comfortable. And right away, I will take the tooth mirror or the mouth mirror and I'll say, look, you can hold it. And if the child wants to hold it, they can hold it. I say, you can put it in your mouth and show me your teeth. It gives them a little element of control. Now, let's say they don't want to do that at all. And they're like, no way, I'm not even going to touch that mirror and I'm not letting you anywhere near me. Then you can say, well, then mommy will do it. So then you give mom or dad the mirror and say, open your mouth for mom or dad to do it. And oftentimes they will let one of the parents do it, and then they'll see, and then the parents say, look, I'm just putting the mirror in the mouth, that's all we're doing. And then what I'll also do is I'll take the mirror and then I'll say, hey, you know what? Let's count your mom's teeth, or let's look at your dad's teeth. And then they'll say, oh, okay, it's not me that you're looking at, it's at my mom or dad. And that way we can say, let's count together, let's look at mom and dad's teeth. It gets them interested, it gets them like, oh, okay, this is all we're doing. And it's another form of tell, show, do, but it's basically getting them out of their mind and anxiety. And then they'll warm up, and then you can just say, now it's my turn. I'm going to do the same thing, and I'm going to put the mouth mirror in your mouth. And 90% of the time, it will be just fine, and they'll let you do it. So that is my tip for you today for treating anxious patients, our little ones, and getting them to open their mouth. Now, if they are really young, or they don't want to, or they maybe like 2 years old, 3 years old, and they're just not going to listen, right? Then at that point, I would just tell the parent, you know what, you're going to bear hug your child. The crying is okay. At least the mouth is open so I can see, but crying is normal. It's not going to hurt. Once I'm done, they'll be totally fine. And if you set the expectation with the parent that their kid will be crying and screaming and really loud, but nothing's going to hurt, they will be okay with it. So get in there, make sure you get a good visual exam, try to get, the Mirror and the Explorer in there, but you don't have to be scared of your pediatric patients. Hope that helps.